Hope Channel, changing lives.
Hello, good evening. Welcome to another episode of Healthy Living on Hope TV. Yes, we are back again with more exciting and educative topics just for you. Today we are also discussing something very educative, and I know that you need to stay by your TV set and hear what you have for us. What we have for you, sorry. Our topic for today is safe medicine use. Safe medicine use. I know that most of us have some certain medications in our homes that we take by ourselves, and we don't even ask whether it's safe for us to use or not. Some of us find ourselves giving some of our medications to others to take for some similar conditions they may face, and we need to know whether that is right or not. I have today with me a professional who is here to help us understand the topic better. Our guest for today is Mr. Mark Enum Nortey. He's a pharmacist and a public health practitioner and advocate. He works as a medical scientific liaison at Johnson & Johnson. Mr. Nortey, you're welcome.
Thank you, Bibi.
How are you doing?
I'm doing fine.
You look fine in your African.
Oh, thank you.
You're welcome.
Thank
Right,
you.
before we start, we'll go for this quick break. When we come back, the discussion begins. Don't go anywhere. We shall be right back.
Na ose won se munko wiase nyina nkoka asempa no nkyere abodie nyina Hope TV kofa by asan ayebio yede eye enkenyan som soronko dwumadie eye akan kasa no mudie no eba wo ho a agina botai kese a yatodu isu se I will go meko efi August eye eda etoso du baako ekosi August eda etoso du enum ewo afimuara dwumadie no ehyaase eye anopa nonum ekowie eye enyumre nonwotwe dwumadi ahodo a yahyehyɛ ewo dwumadi ase eye bra ye ne mmofra bekasa eye bra ye ne eye mmaburu bekasa asofo akukudam betra ase ne yeni wodi nkomo empai bokase nso ewo dwumadi eso asofo a yato nsa frewa ene ye bedi dwumai ebi ne Pastor Dr. Kweni Mbuache, Pastor Dr. Thomas Techi Okran, Osofo Binso eka ho eye, Osofo Emmanuel Nana Imra, Osofo Obenfo SK Chumesi, Pastor Professor Ose Bonsu, Osofo Kwesi Ansedu. I will go dwumadie eye dwumadia edi hye yenyina yehu nkurane na yenya akade a yebetumi ede aboa eye adomachade a nyame de ama ye no yenso yede obi aba eye nyame guanko no mu men you hu fi dwumadie mu I will go.
You've seen some incredible experiments from the Eastern, Upper East and Brong-Ahafo regions. Now it's time for the Volta region to show you what they've got. We might not know what to expect from this episode, but one thing is for sure. This week is going to be thrilling and fun to the max. Let's go! Now showing on Hope Channel Ghana. This and every Thursday at 3 p.m. to 4 p.m. Catch the repeat on Sundays at 12 p.m. to 1 p.m. Don't forget to vote for your favorite experiment at www.wegoinnovate.org. You can vote as many times as you want. It's free. And follow at WeGoInnovate on all social media platforms.
Hello, welcome back from the break. This is Healthy Living on Hope TV, and if you just joined us, we are discussing today safe medicine use. I already introduced our guest as Mr. Mark Enum Norte. He's a pharmacist by profession and also a public health advocate. You can join us or send your questions or comments to our WhatsApp line on 0559 680066. 0559 680066. We are also streaming live on Facebook, so you can join us or watch from there as well. So back to our discussion, Mr. Norte. Thank you for joining us once again.
You're welcome.
And since the COVID pandemic started, how has things been?
Well, you would agree that we are not in normal times.
Exactly.
So we all quickly had to adapt. Our doctors had been at the front line, sacrificing.
Exactly.
And so those who are not within the front line had to quickly adapt. It had been working virtually, working from home sometimes, and doing physical meetings only when it's absolutely necessary. Yes. So far, so good. We hope it goes away quickly.
Quickly, you know.
But
so
until then,
we can go back to our old lifestyle.
Exactly.
Yeah.
Exactly.
Okay, thank you so much. So back to our topic for discussion tonight, safe medicine use.
Yes.
I see a lot of people, and even myself, I'm guilty. We keep certain medications by us. We take it, I'm feeling this way, I'm doing this. Then we just go take it, and then we think we are fine. But inwardly, it may be having some effect on us.
Yeah.
So generally, before we start, can you let us know what at all, if you say medicine, what it is, and then if we have types or categories?
Okay. So I would begin by saying that medicine is any substance that we take to help treat, cure, or manage a disease condition or illness. In some categories too, they may be taken to mitigate against an infection, what is usually referred to as a prophylaxis. Sorry. And then in our current setting too, there are a lot of other medications that are considered as supplements. People usually think that supplements do not qualify as medicines, but they are all categorized as medicines.
Okay.
Our local people, elderly people, usually would see medicine by how it appears.
Okay.
Because you would find medicines that are liquid. There are some that are tablets, capsules. There are some that come like sprays, like what asthmatic patients would use when they have an attack. And then there are some that comes as ointments. These are all medicines. Some may want to consider only the ones that they swallow as medicines, but it's a broad category of medicines. And let me quickly add that they are also known not only by how they appear, but what they are used for. So sometimes your doctor will tell you, I'm giving you an antihypertensive. It's because this medication is used mainly for hypertension. Or an anti-diabetic. Sometimes too, we also consider them based on the type of organism that they are dealing with, especially when it comes to infections. So then you can have an antibacteria or what is properly called antibiotic.
Okay.
That is working against bacteria. And then we've heard of antiviral. In the era of COVID, we've heard a number of claims for medicines against viruses.
Right.
So those class of medicines are called antivirals. And then the women, especially the mothers, know a lot about antifungals because of the skin diseases that sometimes the kids
have.
Yes, kakarere, ekro, and all that.
Those things.
So they are given antifungals because those conditions are caused by fungi.
Funguses.
Yes.
Fungi, yeah.
Exactly. So there are different ways of categorizing medicines, and this would just be a summary of what
the categories.
Yes.
Okay.
Yes, and what medicines are.
All right. So if we say safe medicine use,
yes.
When do you know that, or what is it at all, and when do you know that I'm using this medication safely?
Safely.
Yeah.
Okay. So I would like to allude to a quote by one philosopher called Paracelsus. He made a statement that all things are poisonous.
Okay.
And there's nothing that exists that doesn't have a poisonous property.
Okay.
And it is the dose that makes it poisonous.
Okay.
I'd like to paraphrase. I want to say that all medicines are poisonous.
Okay.
And there's no medicine that doesn't have a poisonous quality. It is only the dose that makes it a medicine.
A medicine.
Meaning if you are told to take 1 tablet and you take 5 tablets, you are not taking it at a dose that will make it a medicine for you. It will rather end up as a poison. So zooming into safe medicine use, then one can argue or explain that safe medicine use deals with how we acquire medicine, use it, store it, keep it, travel with it, or dispose it off in a way that doesn't pose any danger to our health.
A second party.
Or a third party, exactly. So any way we handle medicine such that it doesn't become dangerous to our health is very key. Like I said, it is only the dose that makes it a medicine. Every medicine is potentially
poisonous,
poisonous. Exactly. So safe medicine use is from acquisition to handling to disposing it off and even consumption in a way that doesn't make it harmful to the human body. So as you can see, it's already broad.
Yeah.
You can look at each of the various categories. And that is the way. I would also say you can walk into a pharmacy or even go to a hospital. You'll be provided with a prescription. You get the medicine. You go home. But in each of these stages, if you don't pay attention, you might end up consuming poison into your system. When all you wanted was to have something that will help alleviate the symptoms of your illness or make your life more
comfortable or
healthy.
Healthy.
Exactly.
Okay, now to you've spoken about what safe medicine use is, and then where it starts from and where it ends, which some are even surprising, because initially I know a lot of people thought that just taking in the medicine, drinking your water, that is safe enough. So do we actually have a role to play in ensuring safe medicine use?
Yes. Yes. And I'll say yes again. Because we are the primary person who is responsible for our health. Our doctors are good enough to help us. Our nurses, our pharmacists, our laboratory technicians all play a role, but we are the primary custodians of our health. And that is where it all starts. So we play various roles. One, we are supposed to be knowledgeable about our disease condition, so that based on that, we can understand what role the medicine we are given is going to play in helping us get better. Most of the time, and look at a typical general practitioner or medical doctor, nurse or physician assistant in a consulting room, and the load of patients they need to see in a day. And usually patients would expect that they know all their issues individually. So within the day, they are seeing 80 patients. And each patient who comes expects the doctor to understand their situation. It is practically impossible. So the first point it has to start is that each patient must try as much as possible, each individual must be knowledgeable about their condition, so that they will understand what role their medicines will play. And so, knowing your disease and knowing your medicine guides you on which questions to ask your doctor. Or which questions to ask your pharmacist. I would like us to walk into a consulting room. So if I was born with G6PD defect and I have walked into a hospital sitting in front of my doctor, if I have no knowledge about what G6PD means and the implications it could have on my health when I take certain medications, I won't be able to play that role, that important role in the consulting room that will guide the doctor to know which medicine that will help me. Because we know from medicine that any person with G6PD defect who takes a sulfur-containing medicine could have adverse reactions that could be fatal in some situations. If you do not tell the doctor, they can't guess from your face that you have a defect of G6PD. And so knowledge is very key. Knowledge is a very important part in this. The second thing we need to know, I mean, we know a lot of things happening these days on social media, in politics, etc. So we can't say that we can't sit comfortably and say and be happy that we don't know much about our own health and disease condition. Beyond knowing your disease, you also need to know your medication. Even if you can't remember the names because of some of the big names the medicine comes with, you should be able to know so much about it that you could describe it for your doctor. Because sometimes the medicine you were previously on can guide your doctor in prescribing what he should give. The current practice is that if I go to Rage and I feel that I'm not so fine, I'll just move to police hospital. At that point, that doctor doesn't have a history of
any idea.
And my folder is not there for them to trace my medical history. But at least if I can describe the medication I was on and what my doctor or pharmacist told me it was being used for, it will guide this new doctor to help decide on which treatment regimen would be appropriate for me at a particular stage of my disease pattern. So knowing about medications are very important. Yes.
And you've spoken a lot about the role we play, and you started by saying something about the role we play when we go to the consulting room. I would also want to ask, after the consulting room where the medication has been dispensed to you and then you go home, like it's between you and the medication. Do you still have a role apart from taking the medicine? Like, is there any other thing you need to do?
Yes. You know, when you walk from the consulting room and you go to a pharmacy, whether in the hospital or a community pharmacy, sometimes you don't even understand what is on the prescription, but the pharmacist will manage to understand and dispense something for you. At that point, you need to engage with the pharmacist or the qualified person who would be on duty. And I would like to recommend this. As much as possible, try picking your medication from particular pharmacies.
Okay.
Because it helps a lot. If I live in Adenta, I can identify one pharmacy that I think is convenient for me. You. And I can always be picking my medications from there. If I'm hypertensive or diabetic, the staff or the healthcare providers there would get to know me, and they will know which type of medications
you normally come in.
Exactly. Yeah. In an event where I have been prescribed a new medication, maybe I'm hypertensive, or let me use an example, I'm asthmatic, and this time I went to the hospital with a different complaint, joint pain, and my doctor prescribes a painkiller, and one of the most common painkillers we have are called NSAIDs, like Brufen or diclofenac. Once I get to this pharmacy, they know me, they know I come to refill my prescriptions there, and I'm asthmatic. They'll be able to intervene because NSAIDs are not good for asthmatics. So at that point, they intervene, and then they are able to make a recommendation. And at that point, you can speak with your doctor again, and then the necessary changes can be done. Sometimes I may have a history of peptic ulcer. I pick my medications from the same pharmacy. I've been given an NSAID or Brufen or some other medication that can worsen the ulcer. They can alert me, and then, but if it is a pharmacy that do not know you, then this opportunity,
treat you as a normal,
a new client, and they won't have that knowledge. So that is one recommendation I like to make. Apart from that, at the pharmacy, ask about the instructions to take your medicine. When you are told, you can still ask them to repeat it, and you can try to repeat it. Because at the point when you are being given the medication, you just listen and go. And most of the time when people get home, they forget the exact instructions they were given. The instructions must include how you have to take it, possible side effects. And talking about side effects, let me quickly brush over this. There are several side effects for each medication. It doesn't mean you experience all. Because there are one that is experienced in 10 people, 1 in 100, 1 in 1,000, 1 in 100,000. Maybe what you must be interested in knowing is side effects that happen in every 1 in 10 people. And then you just get to know to keep yourself educated, so that when you're having any reactions, you know, oh, my doctor or my pharmacist told me about this. So I don't have to be alarmed or worried. And then you could ask also, how should I store the medication?
That's very important.
Exactly. People keep their medications in their handbags. Some keep it just...
that's very common, you know, in their school bags, or some people in their pockets.
Meanwhile, the best way to keep any medication is make sure it is appropriately labeled and in a pouch. So if you have a pouch for keeping your medication, that is the best way to go about it. Don't just drop it in your handbag. And the men who use cars will just drop it in the storage box where they keep their license and documents. They keep it there.
Charges and things.
But we all know that when you keep the car parked at the car park in the afternoon, it becomes very hot.
The heat.
So I can bet when you keep your car in your car and you are taking it in the evening, you are no longer taking a medicine. It is something else.
This is serious. So because a lot of people do that. A lot of people do that.
You know, medicines are chemical substances, and they are exposed to environmental pressures. Temperature is an example. Sunlight is an example. So if you treat medicine anyhow, you expose them to this harsh and extreme conditions, you would be thinking that you are taking medicine, but it would have changed into something else. And you come back to the doctor saying that you are not seeing any improvement. Or your condition may have worsened.
Yeah.
But now we understand that the bus doesn't stop with acquiring it.
Exactly.
How you store it
is also very important.
It's very important.
It's very important. So I think we've touched on what role we play at home, in the consulting room, at the pharmacy as well.
Yeah.
And then when traveling, I think you've mentioned that we need to keep it well, either in a pouch, and then keep it in a safe temperature.
Yes.
Yes.
I need to also add that, especially if you are going by flight.
Okay.
You know, the luggages are in the luggage compartment. Sometimes it's extremely cold or hot, depending on the altitude.
Exactly.
So the best thing you can do is, once again, keep it in your handbag, in a pouch with you in the plane. The advantage you have with that is that people miss their luggages. So in the event where your luggage is misplaced, at least your health would not be at risk, because you have access to your medicine to continue taking it at the right time. The other advantage too is that at the point where you need to take it, you are now not going to wait till you get to your transit point or your exit point to retrieve your bag before you can have access to your medicine. Always keep it close to you so that you can you can elsewhere.
In another place. Okay.
So what you need to do is to make sure you have contact of your healthcare provider. If you have a family doctor you see very often, keep their name and their details.
Okay.
Possibly for your pharmacist too. If you have a nurse who attends to you most of the time, do that. Because at a point where, because of delays, I mean, in the era of COVID, people traveled thinking they were going to spend 2 weeks.
Yeah.
They may have packaged only 2 weeks worth of medication. And then now there are restrictions. It's over a month, 2 months. They need to refill. And you can't just walk into any hospital in the US or in Europe or any of these other places with tight regulations
on medications.
Yes. At this point, contacting your doctor becomes very important. They'll be able to initiate a process that will help you get a prescription so that you can refill your prescription, and then you are not adversely impacted just because you traveled. So these are some of the basic points we have to know. That's exactly the same effort we put in packing all our
dresses and shoes.
We should add that same attention
to our medication,
working on our medication. I forgot to mention something about the home. In the home, we store medications anywhere.
Yeah, on a table, somewhere.
And people love to keep their medications by the window. For some reason, I don't know why.
Maybe they want fresh air.
Eye drops will be there. Suspensions will be there. Cough syrups. Cough syrups usually come in brown colored bottles, what is called amber. The same for some suspensions as well. Any medication that comes in an amber colored bottle is sensitive to light and sunlight.
Oh, okay.
So imagine keeping it by the window.
A lot of sun.
Exactly.
It's already become poisonous.
Exactly. So at the end, you harm yourself and you don't get any benefit from
the medication.
As much as possible, let's all have first aid boxes.
Okay.
Or medicine cabinets that we can keep stocks of all our medicines inside. Those we use for first aid, and then those that has been prescribed for us. Some keep them in their bathrooms because they have cabinets, but it has to be positioned in such a way that if you have steam or hot water from the bathroom, it won't have access to the cabinet. Sometimes the bathroom is very humid.
Okay.
and it could make the bottles and the containers moist.
Yeah.
That way it destabilizes the structure of the medicine, and it might not help.
Okay.
And then most importantly, it has to always be at a height that the kids cannot
be able to reach.
I've had I've witnessed an incident where a multivitamin syrup was kept in the fridge at a height that a 2-year-old kid could have access to. And they taste very sweet because of the sugary base. And this kid got into the fridge in the kitchen and gulped everything down. Before the mom noticed, it was too late. So she lost the kid actually, sadly. Because, like we said, it is the dose.
Yeah,
and that makes
make it
a medicine. Exactly. Once you go beyond the dose, anything can be poisonous.
Exactly.
What is meant to cure would rather kill. You know, so these are some of the points and the basic things we need to take note of. It might look like common sense, but if you don't give it attention, you would miss it. And you only learn the hard way.
And you only learn the hard way.
Yeah.
Let's go for this quick break. When we come back, we continue with our discussion. Do not go anywhere.
In Exodus 25, God called Moses to the top of the mountain, and he showed him the whole business of the sanctuary.
And let them make me a sanctuary that I may dwell among them.
If it had not been for sin, the sanctuary would have been in heaven alone.
When sin came and we were separated, what God had to do was to bring man back to himself. And that is what God did through the sanctuary.
It is through the sanctuary that we have gotten what we know today is our temples, our synagogues, and all the names that you can make out of.
What in the world is happening to our churches? A sinner who is coming before God to ask for forgiveness, and you are dancing and jumping
in the name of
praising Him. Praising Him. When angels are prostrating. If we want to find God, we have to go through the sanctuary because He is in the sanctuary.
Join us as we bring your way with the message of the gospel in symbols, the sanctuary.
The Sanctuary Trumpet. You will not want to miss an episode.
Na ɔse wɔn sɛ monkɔ wiase nyinaa nkɔka asɛmpa no nkyerɛ abɔdeɛ nyinaa. Hope TV kɔfa bae asan ayɛ bio. Yɛde ɛyɛ nkenyan som soronko dwumadie ɛyɛ akan kasa no mu deɛ no ɛba wo hɔ a agyina botae kɛse a yɛato do nso sɛ I will go mɛkɔ efi August ɛyɛ ɛda a ɛtɔ so du baako ɛkɔsi August ɛda a ɛtɔ so du enum ɛwɔ afi mu ara. Dwumadie no ɛhyɛ aseɛ ɛyɛ anopa nonum ɛkɔwie ɛyɛ enyumere nɔnwɔtwe. Dwumadi ahodoɔ a yɛahyehyɛ ɛwɔ dwumadie ase ɛyɛ bere a yɛne mmɔfra bɛkasa, ɛyɛ bere a yɛne ɛyɛ mmaburu bɛkasa. Asɔfo akuku dam bɛtena ase ne yɛne wɔn adi nkɔmmɔ. Mpaebɔ kɛseɛ nso ɛwɔ dwumadie yi ɛso. Asɔfo a yɛato nsa frɛ wɔn a ɛne yɛbɛdi dwuma yi ebi ne Pastor Dr. Koenim Buache, Pastor Dr. Thomas Techi Okran, Osofo bi nso a ɛka ho ɛyɛ Osofo Emmanuel Nana Imra, Osofo Obenfo SK Chumesi, Pastor Professor Osei Bonsu, Osofo Kwesi Ansedu. I will go dwumadie ɛyɛ dwumadie a ɛde hyɛ yɛn nyinaa yɛn ho nkurane na yɛnya akade a yɛbɛtumi ɛde aboa ɛyɛ adomakyade a nyame de ama yɛn no yɛn nso yɛde obi aba ɛyɛ nyame guankuo no mu. Men you who fit dwumadie mu. I will go.
Hello, welcome back from the break. This is Healthy Living on Hope TV, and my name is Bibi. If you just joined us, we are discussing safe medicine use, and our pharmacist or our guest here has given us a lot of information on safe medicine use. You can join us or send your comments or questions to our WhatsApp line 0559 680066 0559 680066. You can also join us live on Facebook on Hope TV GH. All right, Mr. Naughty. So you taught us about what medicines are, what role we have to play and all that. We have a question from one of our viewers. He says, what are the main causes of sexual weakness and the remedy for it? Again, is it wise to take any medicine for sexual performance?
Okay.
Yeah, so that's the question.
Okay, thank you. So, I'm guessing the person may have already diagnosed themselves.
Okay.
Sometimes we have very subjective opinions about what sexual weakness are. And occasionally it is informed by what we receive as information in our social circles.
Okay.
So you have young men with friends who tell us lies and exaggerate their sexual prowess.
Yeah.
And then you look at yourself and you are not able to exhibit same. And you assume that you are sexually weak. I'd like to first start by saying that this is a condition that needs to be diagnosed by a doctor.
Okay.
We can't assume we are sexually weak. There are various factors that could lead to that. We understand from psychology and psychiatry that even having a mental health and pressure, being sad,
or stress,
stress, being anxious, could actually decrease your interest in having a sexual intercourse. And that may appear as if you are weak at the moment. Until that's the stress or psychological distress is taken off, you may not fully be able to enjoy having a sexual encounter. There are other chronic conditions that could also have a side effect. So an example is being diabetic. If the condition is not well controlled, because usually when we are started on medication, sometimes we are not judicious in adhering to the medication. We take one today, tomorrow we forget. But the more our cells are exposed to high blood sugar, they become affected, including our nerves. And so whilst we may have numbness in parts of our body, would also be experiencing sexual weakness or erectile dysfunction as well. Having hypertension could also be a possible cause. So there are myriad of causes. That is why I started by saying that this is a condition that needs to be diagnosed
by a health professional.
Exactly. Once they do that, they will look out for the underlying cause
condition
and then treat it and then give you the appropriate medication. Now, I want to look at the second question more as a performance enhancement medication. Which in this case we are talking about sexual activity. People want to enhance their performance, so they take medicines. Every medicine has a side effect, and some may have extreme forms of it, which is what we call the adverse effect. So whilst you are having the benefit of the medication, you may also have these other issues. Sometimes they are well tolerated, you don't even notice it. So it's not an issue. But when it becomes very prominent and it affects your life, then you start having problems with it. Now, I'm talking about performance enhancers. If the medicine was primarily approved for treating erectile dysfunction, it only means that people having sexual weakness would use it to restore their performance to the normal level. But what we see is people having normal performance who wants to raise the bar to take it up. So they are not treating erectile dysfunction. They only want to enhance their performance. What is already normal. And that is where the problem comes in. You could run into a lot
of issues,
of problems. if you have sexual weakness diagnosed by your doctor, you'll be given something to restore it. But if you're a young man, you can exercise, you can eat well, you can remain healthy. That is the best source of medicine to help you perform better in bed. Not the use of bitters, herbal concoctions, some capsules, like it's often advertised on media platforms. They could have harmful implications on your health. And if you have issues in bed, talk to a psychologist, a counselor. Sometimes it is not medicinal issues.
It's just the mind.
It's just the mind.
Okay. Thank you so much for that. We've spoken about medications, how we travel with them and all that. And you spoke about disposing of medications.
Yeah.
So let's say I see that this drug is expired.
Yeah.
Some people even go ahead to take the expired drug. They say it has some
potency.
Exactly. After it has expired. So can you educate us on it? How true is that? And then how do we dispose of medications that are expired? Or even if they are not expired and we need to dispose of any medication, how do we need to go about it?
Okay. So I'll start by saying that once you've completed the course of your treatment, any extra medication should be discarded. You can't keep it for future use. Example is using an eye drop. They'll say put it on your eye, both eyes, twice a day daily. For 2 weeks or for 5 days. After 5 days, there'll still be some content in. People still want to keep.
Yes.
Until a later time. You know, an eye drop, for example, once you open it, that's it. It's not reusable. Once it elapses the duration
that is prescribed,
that's it. It needs to be discarded.
Okay.
And other medications that you need to discard, like you rightly said, are expired medications. Once they're expired, there's no need to take it at all. But how do we dispose it of? Usually we'll keep it in a dustbin. Some will throw it at the local refuse dump. Some leave it in the gutter. Some leave it at various places. Those are inappropriate ways of disposing medicines of. Let's all remember that another aspect of using medicine safely also include disposing it of safely. For any medication that is no longer in use, you can bundle all of them together, and those that are expired, walk to a local pharmacy and tell them that you have expired drugs. You want to dispose them of. They will take it, document it, add it to their boxes of expired drugs, and then they will trigger a process with the FDA. And then it will be appropriately disposed dealt with. If there's no pharmacy in your community, there are hospitals which have pharmacies. They all have protocols of disposing medicines of. You are not supposed to throw it in the dustbin because medicines contain antibiotics. They contain so many things.
Chemicals.
Not all of them are supposed to be back into the environment. They have to be appropriately disposed of.
But this is like a long process. Like I just finished, put it in my dustbin, bundle it into the bigger dustbin outside, and then I'm gone.
So imagine we all have individual blisters of expired amoxicillin in a community in Accra, Ashamai, Tema, Adenta, Ridge, and then we all drop them in the Zoom Lion dustbin. And it is taken to the waste disposal site. What is going to happen is that you're going to have a huge concentration of expired antibiotics exposed into the environment. And we are going to have organisms that will be exposed to these antibiotics. Because they're expired, they are not going to die. Rather, we are going to have very resistant forms of these organisms that we are going to be exposed to. And now when we go back to the hospital and they give us the amoxicillin,
it doesn't work.
It doesn't work because the organisms have already been exposed to this amoxicillin elsewhere. And so when our food or our water became contaminated by these organisms, the existing antibiotics we had couldn't deal with it. And then we'll be having worse forms of infections, etc.
And we need to take stronger.
Exactly. That is why it is important that we do it well. Individually, we'll think, oh, but what is the harmful or repercussions of just a blister of amoxicillin? Yeah. But if you look at a whole community doing the same thing, then it's going to have a huge public health implications on the environment and then on our health as well. Yeah.
Okay, so with medications, we see that sometimes you buy medication, like for the layman's perspective, you look at the medication and be like, this medication, dear, it's like it's powder. Some people normally say that. How is there a way that you can differentiate between medication that is correct, quote unquote, and one that is counterfeit?
There are several ways of doing that.
Okay.
I have to start by saying that it's very difficult, especially a well-done counterfeit medication, because usually a fake para will contain only cassava or powder. It wouldn't have the active ingredient in there, but the packaging and everything will be excellent.
Exactly.
So it's difficult to detect it. That is why you need to take measures, defensive measures. So first, the source you are buying from is key. Buy from a reliable, well-accredited hospital or pharmacy. Do not be buying from our brothers and sisters who have arranged medicines in huge rubbers that you find at Tema stations and at various stations. Exactly. Some are the local champions, they keep it in the bags, walking from village to village, doing all sorts of combination. If you do that, you're exposing yourself to the chances of being treated with counterfeit medication. So the source is very, very important. Another important thing you can look at is the physical properties. If you are someone who is on a who has a chronic condition, and so you are given medication on a regular basis, after having used the medicine for a while, you would be able to pay attention to the color, sometimes the aroma that comes with it, sometimes the taste, if it is a liquid or a syrup, and then sometimes the composition. So you buy a tablet that is supposed to be yellowish. But this time you see that it is yellowish with black spots. It could be fungal spots. It's been exposed to humid and it is having some fungal growth on it. Don't take it. It could be harmful to your body, or it could be counterfeit. Because it was counterfeit, it wasn't properly constituted and prepared. So when it was subjected to environmental pressure, it is beginning to give way. So you detect it. So the physical properties. Another way of being able to detect counterfeit is by looking at the batch numbers. Every medicine has special coding. These days there are barcodes and then there are batch numbers. The address of the manufacturer, the city in which they are found, and sometimes the local distributor is also on it. If you are buying any medication that has all these missing, you are better off staying away from it.
Taking something
and then most importantly, in the era of social media, some people tend to sell medicines online. If you are fond of buying your medications on the internet, you are going to duped. You are going to be sold.
Because you don't have the chance to examine it before you buy.
Exactly. I must quickly add that because of e-commerce and telemedicine, some healthcare facilities, even hospitals and pharmacies, also have online platforms that they try to serve their customers on. So if you want to do an online purchase of a medicine, make sure you are buying from an accredited facility. If you know pharmacy ABC. It's a well-known facility, you know the branch, and you are buying with their app or from their website, then you are safe. But buying it randomly from Tonaton, Facebook, anywhere, or anywhere, eBay, or anywhere, you might run into trouble. Yes.
Right. Thank you for that. Someone is asking, you said that medications are chemicals and they are poisonous.
Yeah.
And so one may ask, if these are poisonous, why don't we go herbal?
Okay, that's a very important question. It is very easy to tag orthodox medication because most of them are synthetic, to have side effects and all that. But it is not different from herbal. Having a herbal preparation doesn't mean it is devoid of side effects.
Substances.
Exactly. Like I said initially, everything has the propensity to be poisonous.
Yeah.
It is only the dose that makes it safe. Every medicine has the likelihood of being poisonous.
Exactly.
It is the dose that makes it a poison. So paracetamol was originally discovered from plants.
Okay.
Everybody takes paracetamol now. They think it's a synthetic molecule, etc. But originally, it was from plant. I'll give you another example. Artemether lumefantrine. The artemisinin molecule, it was originally from Artemisia, plant-based. Even currently, there are villages and communities with these plants that boil it and take it because it's able to protect them from fever and malaria.
Okay.
So there's some overlap of orthodox and herbal medications. The only difference is that the orthodox one has been purified, so the specific active ingredient has been identified.
Okay.
Having said that, that is also not to say that there are not herbal medicines that have also been proven to be effective. But herbal medicines also have side effects. And herbal medicines can be poisonous if you don't follow the instructions that has been given on an approved herbal product. If anyone tells you take morning, afternoon, evening of a herbal syrup or concoction, without telling you that it should be 12 mils,
or
15 mils,
or half cup.
If they tell you half cup and all that, that is vague. Exactly. It should be 10 mils, 15 mils. That is a properly studied herbal medicine. Because if they say take 1 cup, you are going to kill yourself.
If your cup is this size, then it's 1.
Yes.
Then this size to 1 cup.
You know, my pharmacy school professor used to say that everything, too much of everything
is bad.
Even water. Other than that, when people fall into a pond, they wouldn't die because they have so much water entering their lungs and everything, and then they die. So, too much of everything
is bad. I think our time is up. But this last question, the person wants to know if you can mix orthodox drugs with herbal drugs.
Yes and no.
So quickly then we wrap up.
Yes, for properly studied herbal preparations that have been shown to have no drug interactions with the orthodox one.
That you are going to take.
Because there are organizations that have embarked on extensive research in their herbal preparations. They have tried it together with the common orthodox medications like paracetamol, etc. And they have established that for now, there's no potential drug interactions that will lead to death or any adverse reaction. But there are some that we don't know. And usually, they are the herbal preparations we go into our own farm to pick and prepare. They work. they may not work. But what we don't know is the extent to which they are safe when taken together with the orthodox.
Right.
To that extent, then I'll say no, don't. If you do something like that, discuss with your doctor or pharmacist or nurse so that they can advise you. And if you're already on a locally made herbal concoction and you are going to see your doctor, make sure you tell them that you're on a herbal concoction so that they know
whether it will interact negatively or positively with
Exactly. Because if you are young, baby, your kidneys work differently. If you are older, 60 years, 70 years, your kidneys work differently. Herbal medicines have been shown to some extent have adverse effect on kidney function, with people ending up on dialysis.
Yeah.
And that is not to say there are not orthodox medications that also have
cause
those effects. So that is why the conversation needs to happen. Your doctor needs to know, so that he knows what he's giving you, your age, and other factors before you can be given. So the answer is yes and no.
Right. Thank you so much. I think we will end here. Our time is up, and even we've exceeded our time. But I will say thank you for coming. Thank you for spending time with us and educating us. I know that a lot of people have learned a lot. Even myself, I've learned so much from today's episode. May the Lord bless you. And to you, our viewer, thank you for making time to watch. Please make a date with us same time next week from 8 p.m. to 9 p.m. every Monday on Hope TV with me, your host, Bibi, to discuss more about your health. Let's not forget that we are still in the COVID-19 pandemic. Please ensure that all the safety protocols are being followed. Your nose mask should be worn. Observe your physical distancing and all that. May the Lord bless you and keep you for watching. Have a good night and take care. Bye.